Hi, live longer, live stronger with 20 different categories to help you prepare for shoulder surgery. Number 20, preparation. Make sure to speak with your surgeon so you can get a reasonable timeline on how long you're going to be out of work. Sometimes we can return to work right away, and other times it's going to be a long time if we have a physical job. If your employer understands that information that you need time to heal, it's going to be a lot better. Pay all of your bills, your subscriptions. You don't want things to run out when you're recovering. Tell your friends, tell your family, tell your church, tell your clubs, anybody that's going to want to know where you're at. Let them know that you're not ditching them, you're going to be recovering, and oftentimes a lot of those people will help you as well. I cut my hair way shorter than I would normally cut it, so I didn't have to mess with it. I also cut my fingernails and my toenails. I did body grooming. Make sure that your batteries are replaced, especially in your remotes or any devices that you're going to be using while you're recovering. You don't want to have to deal with taking in and putting out batteries with one hand. Those are some things that you can do to make sure that you're ready. Number 19, one-handed awareness. Just kind of think of those things that you might have to do with one hand that's going to be different, especially if it's your non-dominant hand, like mine. So I've had to come up with different ways to do things, different methods on how to accomplish it. As one example, I used to get water all the time with two hands. Now I have one hand. I had to learn how to, with my Hydro Flask, take the lid off the top, which was a lot more difficult than I originally thought. And then we have a Berkey water filter. So we had to actually get a little cart that we put underneath the Berkey water filter, and then we put a coaster on the top of that so that I could put it on the coaster with one hand, and then I could flip the switch to turn on the water and then turn it off so that it wouldn't overflow. So that's just one of the many workarounds that I had to come up with. I've had to come up with many. I'm not going to bore you with those details, but just suffice it to say is to think about those things that you might have to do with one hand that you're not accustomed to doing. So a couple of things for me were plunging a toilet, wiping, putting a blanket over you. That's a lot more difficult than you might think with one hand. And the recliner and the button handles and controls. So we're going to talk about recliners soon, but having the recliner controls on the same side is a good thing. Number 18, personal household items to consider. These are just a list of things, not saying that you need to get them by any means. I actually didn't have to get most of these things, but there might be something on this list that you think that might help you, so I wanted to make you aware of it. A couple of things are a shower sling. So a lot of people say, you know what, I just let my arm drape down to the side. I've tried that and it didn't work for me personally. So a shower sling is something I got. I just went to Amazon, $12.95. It's a little mesh shower sling, and it made me feel a lot more comfortable when I was taking a shower. Like a chair. Some people think, hey, I need a chair for the shower, or, so that they can dry off or they can sit down and they're not quite as sure about doing things. Having a soapy loofah or a sponge is going to be a lot easier. Liquid soap is a really good thing as well, so that you can put that into the loofah, you can spread it around, or the sponge, and you can more easily take a shower. Same thing with shampoo and conditioner. They should all be pumped. So that soap, that shampoo, that conditioner should all be a pump version, so you can do that with one hand. Small towels to dry off. I personally used a big towel to dry off. I found it was easy for me, but a lot of people have said, hey, a lot of smaller towels were easier for me to handle. Hair dryer stands. So if I had really long hair, I would probably want a hair dryer stand so that I can let the blow dryer blow while I'm brushing or combing my hair. Spray deodorant has been a big thing on the list as well. So it's hard to get underneath those pits, especially the one that's operated on. But I figured it out. I just take the stick and I put it here, and then I can lean forward a little bit and I can get under. So I didn't need that, but a lot of people say spray deodorant is a good thing. An electric shaver, an electric toothbrush, especially if you have a non-dominant hand. A wash brush with a long handle so you can get that back a little bit better, or you can get the sides that you normally can't. Dental floss picks, I think, are awesome. So, you have little dental floss picks that you can use as opposed to needing two hands. A bidet, especially a day with a remote. So they're really popular in Europe. They're not as popular here, but you can get them on Amazon or Home Depot, Lowe's, whatever, really pretty inexpensively. And that's something that will definitely help your bathroom hygiene. If you're not into that, you can get moist flushable wipes and a grabber tool. Like if you don't want to reach down on the floor, especially for that first week or two of surgery, to pick something up, it's a little more difficult to bend down for sure. So some people have said they've had success with a grabber tool. Water resistant bandages are good because eventually you're going to have that dressing that comes off after surgery. And if that you have some water resistant bandages that you can put on, or some Tegaderm film, it's just a thin clear film that you can put over that's waterproof, you can protect those sutures a lot better. Number 17, opening containers. Opening containers is going to be a completely different experience with one hand. The most difficult containers that I found to open myself were my pill containers. Those pill containers that have the childproof caps on it are really hard to open with one hand. So a couple of alternatives are to keep the caps off, especially if you don't have kids around. You don't have to worry about that. You can also get little pill bottles from Amazon. You can get pill containers. Make sure that you have an easy to open water bottle. I can't stress this enough. You're going to need to hydrate a lot. We're going to talk about that in a little bit here, but make sure that you have a lid that you can easily take on and off with one hand and you can fill it up. It's a huge one. Shower containers if you need them, toothpaste, mouthwash, things like that. Grocery cans, jars. You're going to have to come up with a way that you can open those things up. And there are jar openers that can open containers. There's can openers that you can get that you can operate with one hand. So those are all really good things. At the very least, make sure that you are able to use either your knees or your feet to open things up. I've had to do that a few times and it does work. Number 16, a comfortable rest area. For a lot of people, you might rest and sleep in the same room. For me, I like to actually have them separate so that I can get out, I can get up, I can move around, be in different parts of the house. That comfortable rest area for me, I set up a recliner and I set up a table. So those are two really important things for me. So that table, I can set my iPhone on it, I can set my remote control on it, I can set my water on it, and I can easily access it with just that one hand without having to move around a lot. Come up with some sort of entertainment that is going to allow you to just chill out, to stay completely still as long as possible, and you can rest. For me, that was a TV. So I have a good TV in front of me. I've got all my subscriptions renewed, like we talked about earlier. I have my batteries fresh in my remote, so I know that I'm going to be good to go. And for me, that was a lot better than just having the place where I rest and sleep in the same area. Number 15, clothes and shoes. If you don't know how to put a shirt on after having a shoulder surgery, click up here, a little white rectangle in the corner, and I have a video that will show you how to do that. One of the most important things for me was to have a shirt that was going to be comfortable. It was going to be fairly close to the size that I normally wear. It was going to have some elasticity to it as well. It was going to have some anti-odor properties to it. And it was going to just plain old be comfortable. I saw a lot of different shirts out there that some people, they cut up like t-shirts and they made like an incision here on the side so that they can get that easily on and off. There's shirts that you can get at stores that are surgical shirts that have a lot of buttons or Velcro. Some people have worn tank tops, and there's a lot of different options for sure. But for me, it was knowing how to put the shirt on and off and getting something that was comfortable. So I got these Under Armour shirts that are just sport shirts, and they also whisk sweat away. So they were really good. I wear them all the time for working out and I love them. And so I just got them a little bit oversized. I normally wear a large, so I got some extra large shirts and I wore those for like the first week and a half. Today is the first day that I've actually worn a shirt that is my size, but it's awesome. Pick the shirt that is going to be most comfortable for you. Elastic bands, waistbands that are really easy to pull on and off for underwear, shorts, or pants, that type of thing. And then for shoes, it's pretty simple. Just get things that you can slip on. So for me, it's during the summer and I can easily put sandals on. So I'm just putting on sandals as that I go out of the house to my physical therapy appointments, and I'm wearing slippers inside the house. So really easy. If it's during the winter, you can slip on some boots, or you can put on some tennis shoes that have like those little elastic shoestrings that you can put in. And those are a really good option as well. Number 14, make sure you have a good sling and liner. It's really going to depend on your surgery, what your surgeon recommends, and what you had done. So ask your surgeon what that is. And most of us are going to come out of our surgeries with a really good sling. I have what's called a Donjoy Ultra Sling 3 here. It's been super comfortable. It's been great. But I have heard stories from other people, which is why I'm mentioning this portion of the video, not having this little pad here. So that it's an abduction pad. It abducts your arm slightly away from your body. And I've seen some people that have had rotator cuff surgery and they don't have a good sling. They're uncomfortable with it. So just make sure that you have a good sling, that you've talked to your surgeon. Am I in the right one if that you're having any kind of discomfort at all? One of the things that helps me with my sling as well is that I put pillowcases inside. So we have a bunch of extra pillowcases. So I've just lined it here, and that helps me so that I don't get this all dirty and nasty inside. And especially when I'm like riding an erg bike or I'm just walking and I'm building up a little perspiration, this just really helps. And it actually keeps me more comfortable. There's some areas in here that kind of rub on the inside of your skin in a little bit. So it just really helps keep you comfortable. One of the other things that you can do, I've seen people do, is put a seatbelt cover right here on your neck strap so that it's a little more comfortable, or if you're perspiring or something, it's just a little more protection. Number 13, meals. It's going to be a lot harder to prepare food to cook with one hand, especially when you're hurting for the first 3 days, week, 2 weeks, whatever it is for you. Be prepared to have meals in place. So for me, I was really lucky. I have my wife. She was able to take care of me and she's able to prepare my meals for me. Not all of us are that lucky. So I wanted to give a few tips and tricks for people that might think about doing other things solo. A lot of people do meal preparation every week at a time. And so maybe think about doing something like that. Or you can purchase easy prepare meals that are going to be easily accessible for you to pull that container open with one hand. Maybe you can get a meal helper, have friends or family or neighbors come over and they can each have a day or a meal that they can help you with. You also have Uber Eats or delivery services, but just think about that before you go into surgery that, hey, you do need to eat and you should have some good nutrition in place. So make sure that you've put that into your mindset. Number 12, ice packs or an ice machine. For me, this is critical. I think for a lot of people, this is a critical thing. Some people don't use ice. Some people don't use the ice machines. I get it, totally cool. But for me, both of those things were highly important to my recovery. And they helped immensely with pain control and with swelling. So I would highly recommend either ice packs and or an ice machine. So ice packs come in many different colors and flavors. The ones that I would recommend are the ones that are pliable and flexible, that will form fit around you, that don't have a lot of weight to them. They hold the cool for a long period of time, and you can put them back in the freezer and reuse them. You could use gel packs. There's clay packs that you can use, or you can even put like frozen peas on that shoulder. There are ice machines as well that you can get. Those can be either rented or purchased. A lot of people will freeze water bottles. They will put them inside the container of the ice machine, and they will fill the rest with water. And it just recirculates cool water through a pad that you put on your shoulder for an extended period of time. And again, you can turn that off and take a break and then put it back on. A lot of people recommend 20 minutes on, 20 minutes off, or whatever it is that your surgeon or physical therapist recommends. But I would highly, highly recommend ice machines or an ice pack. Number 11, a comfortable sleeping area. Guys, this is so important. You need to have a really comfortable sleeping area. And it's not going to be as easy as you might think. So first of all, think about quiet, dark, and cool. So if you can get that room dark, if you can get it quiet, and if you can get it cool, those three things right there will help you sleep a lot better in itself. But as you have a shoulder surgery, it's going to be really, really hard to sleep at all. Most people have used a recliner. They have repeatedly said it's incredibly crucial to get a recliner. I have a recliner in two areas of my house. One is my sleeping area, and I have it right next to my bed, and I absolutely use that all the time still today. So my first day I came back, I used the recliner and I was able to get some sleep. The second night I tried to use the recliner and I was able to get a little sleep, and then I got really uncomfortable. So I went over to my bed and I was able to lay on my non-operated side, and I was able to get some sleep that way as well after I built a little bit of a nest, and I'll talk to you about that here in a second. I still use that recliner on a regular basis to take little naps, or if that I get a little bit too achy laying in bed, which happens on a regular basis, then I will get onto that recliner and I'll be able to sleep a little more comfortably for a little bit. So it's basically for me about getting into different positions that are comfortable. As far as sleeping in a bed, there's a lot of different ways to do it. Some people buy adjustable beds. Some people get a foam wedge and they can put that up on their bed and they can build like different pillows around them. So some people also say, hey, smaller pillows are better. I've heard people say larger pillows are better. But what I would say for you is just to basically see what you can do to build the best possible nest that is most comfortable for you. Whether that's with the foam wedge, an adjustable bed, a regular bed, a recliner, small pillows, large pillows, whatever it is, you're going to find a position that is more comfortable for you. That most people that I've heard of and my own experiences definitely get the recliner for sure. One of the other things is blankets. So with blankets, make sure that you get something that's going to be comfortable for you, but not too heavy, because it's a lot harder to put one blanket over you than you might think. So if it's really super big, it might be harder for you to put over. If it's too small, obviously it's not going to cover you. I personally got some what are called Miki Couture blankets. That's not something that I'm recommending or endorsing by any means, but my wife loves them. She got me one that's really big enough for me, and I absolutely love it. I use it every single night. Number 10, know your meds. We're all different. Our surgeons are different. Our procedures are different. And even though that we have similarities, our meds could be very different. Common types of meds that are prescribed after shoulder surgery, we have the opioids class, and you have a lot of different types of opioids. There are a lot of different brands of opioids as well, but those are for pain control after your nerve block wears off. You also have stool softeners from general anesthesia, from the opioids. Those things actually reduce the mobility of your digestive tract, and it kind of stops you up. So it is highly recommended by most surgeons that you have some sort of a stool softener and you keep up on that so that you can become regular after surgery. You also probably get nausea medicine. I fortunately was not nauseous at all, but a lot of people do get queasy stomachs, and so they give you different types of medications for that. Will hopefully keep you more comfortable. There's also NSAIDs. So NSAIDs, at least for me, my surgeon said, hey, no NSAIDs like a week before surgery and nothing like for 5 days after. I think that's a pretty common recommendation, but please check with your surgeon on all medicines, making you aware of the types of meds that are generally prescribed. And again, yours could be very different. NSAIDs are something that you can probably help with pain control a little bit later on, but talk to your surgeon about that as well. And then, of course, there's good old Tylenol. So I was able to take Tylenol right after my surgery and my nerve blocks started wearing off. I didn't have to use opioids at all. And the Tylenol and ice really helped relieve my pain. And I was totally good with that. So know your meds. Number 9, pain control. This is probably one of the more important things that you're going to want to do after you get home from surgery. I would highly recommend the nerve block. A lot of people are saying, hey, I'm not sure if I want the nerve block. And of course, talk to your surgeon talk to your anesthesiologist. Your anesthesiologist is the person that's probably going to administer that for you. The nerve block may not be right for you. But if they offer it to you, I would definitely recommend it. It helped me quite a bit. I was able to keep the pain down for almost 48 hours just because that I had a nerve block, and it was really, really helpful. Make sure that if you are prescribed opioids, that as soon as that you start feeling tingling in your fingers, and your surgeon says, hey, your nerve block should wear off in 24 hours, and it's been 20, you might want to start taking your opioids so that you can stay ahead of the pain. You don't want to wake up in the middle of the night or suddenly in awful pain. That's a horror story that I hear from a lot of people, so hopefully you can avoid that. Obviously, make sure you speak with your surgeon. That's going to be different for all of us, but make sure you're ready for that. Some of the other things with pain control that really help me is ice packs on a regular basis and Tylenol. And I could take those things right after surgery as well. Not only stay on top of your med schedule, but log your meds. So keep a piece of paper or something that you can, on your phone or whatever that is easy for you, your caregiver, so that you took this type of medication with this amount at this time. Because you can't just take medications like every hour. As one example, when people take NSAIDs later on in the process, like probably a week after surgery or more, depending on what your surgeon tells you, you're going to have at least 6 hours between dosages of your NSAIDs. So you can stagger medicines sometimes. And again, this is up to your surgeon, but you could take, say, at noon, you take NSAIDs. And then 3 hours later, you can take Tylenol. And then 3 hours past that, which is a total of 6 hours between your NSAIDs doses, you can take another NSAIDs dosage. So you can stagger meds like that as well based on the advice of your surgeon. Make sure that all of this is okay with your surgeon. It's just something that you can be aware of, that you can do to help keep that pain control down. But just make sure that you have enough time between each, that you're following your guidelines of your surgeon, when you can take those meds and how much that you can take, and use a log. Use an alarm if it's during the middle of the night so that you can wake up and that you can get those meds into your system before they wear off and that you're in awful pain waking up. Number 8, move. As soon as you have that pain under control, try to see if that you can stand. Try to move around a little bit, walk around a little bit. At first, take it easy, do it just a little bit, but eventually you should hopefully be able to move more and walk more. And the more you can move and the more you walk, the better you will most likely feel. So they say that sitting is the new smoking. And a lot of sedentary people, they don't heal very well. You have risk of blood clotting, you have risk of poor circulation. So the more that you can move once that you have pain under control, the better you're most likely going to feel. For me, I know it was wonderful. I was able to just stand up and be in a different position with my arm. That alone was amazing to me. And then I could start moving and walking a little bit. I just felt so much better. I felt my circulation working. I felt my blood flow working. And it actually promotes healing. It will help you recover more quickly. So make sure that you move as much as you can within reason of what your surgeon's guidelines are as soon as you can. Number 7, hydrate. So we talked earlier about having a good water bottle that you could open and close with one hand. But don't just have the bottle, use it and use it a lot. So you have that general anesthesia after surgery. You have probably opioids and you have other things running through your system. Your digestive system is slowing down. You want to hydrate. Hydration helps your digestive system. Hydration helps flush your body. Hydration helps the repair process with your shoulder. Hydration helps so much, and not too many people do it enough. So make sure that you hydrate, hydrate, hydrate. Flush that body. It's super, super important. Number 6, adequate sleep and nutrition. Getting adequate sleep is so important. That's where you're going to heal. That's where you're going to recover. A lot of people report that it's hard to sleep, and you're right, it absolutely is. I still struggle with it, and I'm 12 days out of my surgery right now. It's something that you don't have to get in a big 8 or 10 hour chunk if that you can't. If you can, fantastic. I've been able to get some big chunks myself. But what I typically do is that I'll sleep for a little bit and then I'll wake up for pain and I'll have to adjust my position and then I'll go back to sleep and I'll repeat that process over and over. Maybe I'll go and I'll lay in that recliner. The point is that sleep doesn't have to come all at once. You can get it in chunks. Keep getting as much sleep as you possibly can as you're healing, and that will help you heal even more. Eating nutritious food is something that I know that probably most Americans don't do. And it's hard to eat nutritious foods. But if you can eat good meats, vegetables, fruits, nuts, seeds, some starch, cut out most of the sugar, that's just going to help your healing process. The more nutritious food that you can consume and eat, the better you're going to be off. Try not to eat junk. Try also to put meals that are easy on your stomach. So remember, when you first get out of surgery, you're going to be probably a little more plugged up, right? From the general anesthesia and from the opioids, things like that. You might be a little more queasy. So it's going to be harder for a lot of people to get food on their stomach. So plan for that ahead. Make sure that you have foods that you will be comforting to you, that will be comfortable going down. And then maybe think of different ways that you can get some foods that you like in your body. So one good suggestion that I have is, number one, don't have dairy if you can't help it. If you're getting plugged up, dairy is not a good thing. You can read up about different things that will help your digestive system and that will prevent your digestion from happening. One of the things that I like to do is I like to liquefy my meals. So being into fitness and training, I often have like a protein shake. I'll put some like almond milk, some blueberries, bananas, and I wasn't plugged up really much at all. So I did put some 5% Fage yogurt in there, put some cacao nibs, put my protein powder and some ice, and I blended it up. And it was like this nice, nutritious shake that was also really easy to consume and to digest. So again, that's just one example. Maybe that sounds really gross to you, but there's probably foods that you love that you can do the same type of concept with and put those in a blender, and it's just going to make it easier to consume and to digest. Make sure that you keep up on your nutrition. Number 5, your physical therapist. Don't just go to any old physical therapist. Review, you research, you interview different physical therapists and talk to them. They're willing to talk to you, just most people don't. So take advantage of that. Look at reviews of the different physical therapists that are out there. And then find one that has the same mindset that you do. Find one that you're really comfortable with, that you think that's really going to help you, because there's a lot of physical therapy shops that you just can go into and they're just going to put you out like a number. But I wanted to find the physical therapist that I knew was going to really help me and was going to be invested in what I was doing and had the same mindset that I had. Mine was return to sport. So I got a physical therapist that is into weightlifting and to CrossFit and general fitness, and he knows what I'm looking for. That's one of the things that I think is really important for people to do, and not enough people do it. The other thing about physical therapy to think about is to know how many sessions that your insurance company will allow you. So mine I get 20 sessions. That's it. And some others might have 40, or some might be unlimited. If you're unlimited, great, you're super lucky, but most of us aren't in that boat. So know how many physical therapy sessions that you have, and then talk to your therapist about you and your situation on how you should use those. So for my therapist, he said, hey, you know how to work out. You've already been really strong. You know how to do rotator cuff work. You know how to do a lot of the stuff that we do later on in physical therapy. But for you right now, that mobility is key. You need to get that mobility going. So he wanted to front load my sessions more than put them toward the end. And for me, that was the right move. But for you, it might be something completely different. But get a good physical therapist, know how many sessions that you have, and use them efficiently. Number 4, a good helper or a good support system. Immediately when you get done with your surgery, you're going to need somebody to drive you home. You shouldn't be driving for many reasons. Number 1, you have one arm. Number 2, you just came out of general anesthesia. You're just not in a good place to be driving. So get someone to drive you home at the very minimum. Someone being there at the surgery center with you to get the post-operative instructions from your surgeon is really helpful. I was really lucky that my wife was able to record my surgeon, he allowed it, giving post-operative report and instructions on what he wanted me to do until the 5 days that I would follow up with him later. Those post-operative instructions I wouldn't have understood right away. So it took me a couple of days to kind of digest what I needed to be able to do, but my wife knew because she was coherent. Somebody to cook for you, to cook your meals, somebody to give you general assistance, just getting up and down is really helpful. Being able to shower whenever your surgeon says that you can actually take that first dressing off and you can shower, having somebody to help you do that is really, really, really helpful, at least those first couple of times. Not only just like the first week of therapy, but my wife is helping me with ongoing therapy, and it's been super, super helpful. So a lot of us are really lucky, like myself, where we have a significant other that can help us. If that you don't, you can think about parents or children, friends, neighbors, somebody in your church or clubs that you might have. Even hire a skilled healthcare provider service of some sort, at least for that first week. And then maybe you have a local hospital or clinic where they have volunteers and they like to go around and volunteer. So there's a lot of different options. I'm sure that you can think of even more. But the point is to make sure that you have a good helper or a good support system in place. It doesn't even have to be the same person. Maybe you have different people helping you with these different things at different times. But just have some help for that first week with those things, and it will make things a lot easier. Number 3, a shoulder surgeon specialist. So there's a lot of different orthopedic surgeons out there, and they're capable of operating on several different body parts, and they often do. For me, I wanted to find a specialist, a person that only operated on shoulders, that's all they did. They have more experience, they have more time doing those things, they see more patients, they see more recoveries. And for me, that's the specialist that I wanted to get. How do you do that? You can look at reviews online. There's lots of different reviews, like Google reviews might be okay, but there's usually reviews on each surgeon, or you can read about them. You can read what they do, what their specialties are, what they operate on. You can make appointments with the different surgeons and interview them. You can go and say, hey, well, give me a diagnosis, but you're also interviewing them at the same time and getting a feel for what they do, how they do it, what their mindset is, and is it the same with as yours? Is it aligned? You can also look for the surgeons that exclusively do that. When you look at the website and you see that that's all they do and they've been doing it for 30 years like mine has, then you're probably in a pretty good spot. And I would still interview them by going at least to an appointment with them. You can also look at the teams that are out. If you have a professional or a college team or even a high school team out, who are all those athletes going to if they have an issue? But the point is that you want to make sure that you get somebody that is good for you. Whoever you feel comfortable with, make sure that you go with that person. Number 2, recovery compliance. What is recovery compliance? It's simply following the instructions of your surgeon and your physical therapist post-surgery, making sure that you're following all their instructions and doing things to the letter. One of the things that, as I've been reading, watching videos, talking to different surgeons and different people, is that I see there's a vast variety of recovery compliance going on. The people that usually have a higher degree of recovery compliance usually fare a lot better and have a much better result. And I'm saying usually. It's not always the case, of course, right? And people that usually have less of a compliance for their recovery, they don't recover nearly as well. One of the things that I want to make sure that I'm doing is that I'm doing everything that my surgeon asked me to do. I'm doing everything that my physical therapist asked me to do. And I did at one point decided that I do a little bit more, and that's also not a good thing. So don't do more than they've asked you to do as well. There is a long process in tendon healing. Just of the strength of repair, you're about 30% in 6 weeks, you're about 60% in 12 weeks, and you're 80 to 90% after 6 to 12 months. So it takes a long time. And for you to do that, you have to follow those instructions. You have to decrease your pain and your swelling as best you can in the beginning. Then you're going to start working on passive exercises only to increase your mobility. You're going to hopefully learn not to guard. So guarding is basically when you're holding your arm up like that and you're really stiff and tense and tight. I did the same thing, so I had to learn to really extend and to relax that shoulder as much as I possibly can. And as that I've gotten stronger over these 12 days, I've wanted to do more with my right hand. And I have to keep telling myself that I can't, that I shouldn't pick up anything, that I shouldn't be typing, I shouldn't be doing anything with that right hand, so that I'm completely compliant with what my surgeon and my physical therapist are telling me to do. A couple of other things that I've found that have been useful is that I talk to my surgeon and my physical therapist that about sometimes you'll be sleeping and you'll jolt and you'll get this pain, the sudden pain. If you return to baseline after a few minutes, you're good. You probably didn't injure anything. You're fine. So don't stress or worry about those little jolts. Try to not guard as much as possible. Try to avoid reacting and catching things, because that's one of the things that's going to be easy for people to do. It's just a reaction type of a situation. Try not to drive. I'm probably not going to drive for at least a month after I'm able to get my sling off, so that I can get that repair feeling better in case that I have some sort of an issue. So, that's just me. I know a lot of other people have to drive a lot earlier. And one of the things for me, instead of typing on my mobile phone, I'm actually dictating. I'm using Siri on my iPhone, and she's not perfect, so I have to go back and correct things, but oftentimes I can get a lot of information out for a text or a Facebook post or something like that. So I'm trying to only use my left hand doing that. Be ready to chill out for several months after you have your surgery. I know that not all of us can do that, but the longer that you can stay chilled out, the better your recovery chances are going to be. Long story short here is that it takes a long time to physically heal. And so just learn to be patient and heal as well as you possibly can. And number one, positivity. Don't stress out. Use the power of good thoughts to know that you're going to be better. It's easy to get down and out. You're in pain. It's hurting. You can't do the things that you normally can do. And it's a really long recovery. So it's easy for people to get depressed or to get really discouraged. Don't. Try to think about things that make you happy. Think about the positive things in your life. Tell a joke. Watch a comedy. Whatever it is for you that you can do, stay positive. Keep people in your life that will help you remain positive, that will encourage you, and continue to encourage yourself. Because it can be a dark place, but the point is that you will make it. Be positive, stay positive, and you will come out of this stronger than you have ever imagined. If you found this information helpful, please like and subscribe. Share it out to other people. Let them know so it will help them. I hope it's helped. Talk to you soon.